I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to another Commissioners Board meeting. This is the board meeting for April the 22nd. We're broadcasting via Microsoft Teams live event and broadcasting to BCTV, as well as our YouTube and Facebook live pages. At this time, I'd like to recognize my executive assistant, Mary Buer.
Thank you. Public comment will be accepted through the Q&A function. Please include your first name, last name, and municipality. Any comments without name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by the limitations of the platform being used, Teams, Q&A, Facebook, or YouTube. The meeting comment period is limited to 30 minutes in total. Please be concise. Comments will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you very much. As always, we will begin with a moment of silence, followed by a pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. As we do each week, we will begin with our Berks County COVID-19 data report. It's being presented by Brian Gottschall, our director of the Berks County Department of Emergency Services, as well as the lead for the Berks County COVID-19 leadership team. Brian Gottschall.
Good morning, commissioners. Thank you very much. Yes, as you said, April 22nd. As always, we'll take a look at the state's early warning dashboard for Berks County first. Very good downward trending numbers regarding cases, incident rate, and positivity. Some slight upward trends, although very small, with respect to hospitalizations, emergency department visits, and patients on ventilators. We will take a look at our local hospital numbers, and they look a little bit more promising than this data would indicate. But again, we want to see things happen over weeks to really say that a trend has changed. But nevertheless, every week we have to celebrate whatever good news is there, and this is some marginally good news. Our case counts appear to have flattened out from the rather sharp rise that they were on for a number of weeks. We're still seeing an up and down motion day in and day out, and we're not seeing any clear downward trend, but at least we've somewhat leveled out from the sharp rise that we had seen. And again, with time of year, as we're moving into April and May, our hope was, even though we were seeing a little bit of a spike come along, that the changing in the seasons this year, as it did last year, would give us some positive benefit in flattening out the case numbers and having them tip over into a decline. Our positivity numbers are still very high, again, indicative that perhaps we have only sick people going and getting tested. Again, I say only, that's a generalization, but a preponderance of sick people going and getting tested, less people who are getting tested out of curiosity or because they've been contacted by a contact tracer and remain asymptomatic. But again, indicative that there is a significant amount of COVID out there in the community, and we need to continue to be concerned about it. Unfortunately, we've seen that our death numbers have started to go up a little bit. And while this is unfortunate, as I said, it's also not unexpected. We've been talking for a number of weeks now about the concept of lagging indicators, how cases come first, then hospitalizations come second, and then unfortunately deaths come later. So the fact that we're starting to see these death numbers tick up is not unexpected, given what we've been talking about week over week with increasing case counts. Our hospitals, for the first time in a number of weeks, are reporting a downward trend in their number of patients in-house with known or suspected COVID. As I said, we want to see this over a number of weeks to say that there's really a change, but nevertheless, good news even over 1 week. Our county comparison snapshot remains relatively unchanged, as it has week over week for some period of time, indicating that what's happening in Berks County is not significantly different than what's happening in any of the other counties around the state. We're moving up and down with those other counties and the various metrics that we're examining. Vaccine administrations effectively unchanged from last week. Last week we were 9th in partially vaccinated and 11th in fully vaccinated. We remain 9th and 11th this week. Of course, we want to get those numbers up, but since we know that we've been level set by DOH given the amount of vaccine coming into the county, it's very hard to imagine that we're going to change these numbers anywhere except down, given also that some of the other counties have been designated as regional vaccinating sites and are getting large influxes of vaccine for those regional sites. Just a little bit of an advertisement again for DOH's vaccine opportunity page. If you go to DOH's website, there is a map there that shows you where first doses are being allocated throughout the Commonwealth, much more handy than it used to be. And just a summary, in Berks County last week, about 26,500 doses received among 26 providers. Those are first and second doses. That is a little bit of a downward tick from where we were the week prior, and we'll look at that in the upcoming slides here. Our weekly eye chart of who all the providers in Berks County are who received vaccine this week. Again, if you didn't get vaccine in this given week, you come off this list, but if you get it next week, you go back on. So this does change from week to week, just so the public knows where the folks are that are receiving vaccine in any given week. This is our week by week overview. Again, we've consolidated weeks 1 through 6. As I mentioned, we see a downward trend of about 1,250 doses or so from last week to this week. You'll take note in the Janssen column that week 17 last week was the first week that we got the Janssen J&J vaccine. Then with the hold that was placed on that, we of course got none of that this week. That accounts for more than the decrease that we've seen in the amount of vaccine coming into the county between last week and this week. Looking at our vaccine equity evaluation, cumulative through week 18, we see the populated counties, including Berks, still in a very bad position compared to what we would assert they should be based on population, but each of them making very small improvements week to week. And as I've said over a number of weeks now, because they've somewhat adjusted allocations on a week-to-week basis, after many, many weeks of those adjusted allocations, we'll of course start to see improvements in the cumulative number, but it takes many weeks of improvement to change that cumulative number because there were so many weeks of inequity prior to that. So I'm going off the top of my head here, but I want to say that if we looked at this like 3 weeks ago, Berks was at 52nd, then a couple weeks ago we were at 50, now we're at 49th, and we're not going to see big movement in that without a significant change in the way vaccine is allocated in the Commonwealth. But looking at week 18, while the numbers are still not where we'd like to say that they should be, we do see that Berks is 29th, much better than 50th, and that's why those week over week of 26th and 29th are going to create improvements to that 50 number. Want to point out here, we've been for the last couple weeks trying to really help people to focus on where to go to figure out where to get vaccine. And we hope that people will look at the Do Your Part Berks website. Steph Weaver, our public relations and external affairs person, is doing a great job in communicating with all of our vaccine providers to try to keep this as updated as possible. It doesn't say that we don't ever miss one. Sometimes they don't tell us. They schedule a pop-up clinic and we find out about it too late to get on the website, but she really does a great job keeping in touch with these people. And this week has actually done a fairly significant graphical revamp of the website to make it even easier than it had been. You used to have to go in and hover in the header, click, and then get to a next place. Now you go to the doyourpartberks.com webpage and it looks just like the screen clip that I have underneath there. There's a direct link to sign up here that takes you to the page in Do Your Part Berks where it has all of the providers that we know about and the links out to their local clinics, as well as has a link out to the DOH-defined regional vaccine center at the Park City Mall, where folks in Berks County are more than welcome to go and receive vaccine. They have a very large number of appointments on a daily and weekly basis as our regional vaccine center. So, Commissioner, that's the end of the report, but I do want to mention one last thing. Last week, we had a question from the public, and I apologize if I get wrong who it was, but I believe it was either Mr. or Mrs. Archer, who are often commenters on the meeting. And there was a question with respect to breakthrough infections, and I didn't have the answer, but I went to CDC and looked into this and did a little bit of investigation, and am prepared to answer that question this week. And basically, the crux of the question that was asked is how many people who have gotten COVID vaccine or have then gotten COVID? And it's a great question. It's something important to all of us as we evaluate the risk-benefit analysis of should I get a vaccine. And I just want to mention CDC's definition of this. What is a breakthrough infection? I mean, I actually even know somebody, and we've all heard anecdotally about somebody that went to get the COVID vaccine, and then the next day they didn't feel good. They went and got tested and they had COVID. They didn't get COVID from the vaccine. They coincidentally contracted COVID at the same time that they happened to have an appointment for vaccine. A breakthrough infection is someone who has been vaccinated and then through either a RT-PCR or other molecular test or an antigen, a rapid antigen test, are diagnosed as having COVID more than 14 days after completing the full vaccine series. So again, immunity is only presupposed after you've had the full series. If it's J&J or Janssen, that's 1 dose. If it's Pfizer or Moderna, it's 2. But then it's 14 days after that that your body's believed to truly have developed the immunity that the vaccine is going to provide you. So they only count a breakthrough infection if you are tested as positive 14 days after finishing your vaccine series. And this is the data. It's some interesting data points. 75 million people in the United States as of last week were vaccinated, fully vaccinated against COVID. There were 5,814 reports of vaccine breakthrough infections. So that's 1 in 13,000. I would argue that's a really small number. I mean, it's 0.0007%, I believe. Of those breakthrough infections, almost half of them were among people over 60 years of age who we know are supposed to getting the virus. So we know it's more likely that those people are going to have infections, are going to become symptomatic, and then likewise likely report for testing to see if they are infected. 65% of the people were female. Interesting statistic. I don't know whether that's statistically significant and means anything, but it is interesting nonetheless that 65% of the breakthrough infections were female. About 30% of those breakthrough infections were asymptomatic. So these are people that were not reporting any illness related to COVID, but for some reason ended up getting a COVID test and found out that they were COVID positive. 7% hospitalized and 1% died. So again, I think that what this really drives at is having the vaccine is beneficial. Although there are folks who get the vaccine and do end up getting infected, and we knew that that was going to be the case, even the very high effectiveness numbers that were originally reported out of the gate, while they were high, there's still a segment of people there who were known that they would be vaccinated and were likely to still contract COVID. And I think that these numbers are very well in line with what has been reported. So we respect that everybody has to make their own decisions, has to do their own risk analysis, but I would hope that looking at this data, folks would agree that there's no reason to say, well, what's the point in getting the vaccine? You still get the infection anyway. Very small numbers, it is possible, but I don't think it's something that should detract somebody from deciding for themselves or their loved ones that the vaccine should be sought. So again, thanks, Commissioner, for the opportunity to kind of wrap that up and go back and answer that question. That's all that I have for today.
Thank you very much, Brian. We'll go now to Commissioner Kevin Barnhart, and he is going to give us an update on Cook County Wellness Report, as well as the vaccine clinic. For those that are used to the jail COVID report, we have no new data today, so it's just the vaccine clinic and Cook County Wellness update. Commissioner Barnhart.
Thank you, Commissioner Linebach, and welcome everyone this morning. We did not have a Cook County Wellness update last week, but I do have it. For the week of April 7th through April 14th, there were 593 new contacts. 72.4% were reached, and there were 74 line lists last week. Going through the end of last week through this week, April 15th to the 21st, we're up to 719 new contacts with 72.4% contacted. Gives us a gross total since inception of Cook County Wellness contact tracing of 12,985. And just a point of reference, we did allocate last June $1 million contract to Cook County Wellness. So far, they have expended $136,681.97. If you include $81,710 of volunteer time, the total would have been $218,392.20. Certainly a very cost-effective method to do contact tracing in Berks County. They have successfully opened the call center at 1-888-712-2772. It's staffed Monday through Friday, 9 to 5. The first 3 days of the call center, they received 152 calls. Some, at least 8 were Spanish speaking only, so it's great that we have bilingual call takers at Cook County Wellness. And presently they are directing people and signing people up for other vaccine centers and mass vaccination centers as we start to roll into our vaccine center at the North Reading Plaza. All systems are go right now. It looks like we're going to be doing a soft opening on a Saturday forthcoming with BCHC staff in place. And then soon after that, open up the following week. We're still awaiting some final clearances of these temporary staff that was hired through GARDA. They need to have significant background checks, FBI clearance, fingerprints, and the like, because they're working in the public in a healthcare facility, and these are requirements for a federal health center. We learned very positively yesterday from Mary Carbo from BCHC that they have the availability of receiving 10,000 doses a week. We are projecting to be able to administer 1,600 a day at the North Reading Plaza facility once opened. So that would consume about 8,000 of those 10,000, and the balance of 2,000 can certainly continue to be administered at BCHC on Rockland Street. BARDA continues to receive requests for shared ride service. As of yesterday, 188 people took advantage of the opportunity to go to vaccine centers using the shared ride service. So that's where we are in a nutshell. We are very close. The call center is working without a hitch. It's going amazingly well, giving us that soft opening. We're going to do a soft opening of, again, staff from BCHC and some other volunteers that have been doing other vaccine clinics in a very close to a Saturday, probably May 1st, and an open probably midweek the following week, and anticipating to be able to do up to 1,600 a day for 5 days a week. That's what I have, Commissioner Linebach and everyone else, so I'll turn it back to you.
Thank you very much, Commissioner Barnhart. Relative to the minutes, I do want to note one correction. On page 7, there is a line that was credited to an individual commenter from last week's meeting that was incorrect, and that has been deleted from the minutes. Are there any other additions or corrections to the meeting minutes? Hearing none, the minutes will be accepted as amended. I also want to note that we did have an executive session yesterday. It dealt with personnel, litigation, and security. Mary, are there any comments on the agenda items?
There are none.
Okay, we will move into the agenda. Item 1 under authorizing, under that, Budget Department. Adopt a resolution authorizing 2020 budget transfers in the amount of $18,732 2020 appropriations in the amount of $44,332, 2021 budget transfers in the amount of $1,497,310, and 2021 appropriations in the amount of $37,152 per listing dated April the 19th of 2021. There's several items listed under Human Resources. Item 1, authorize the appointment of Brian Rudolph to Computer Forensic Specialist in the DA's office. Item 2, authorize the appointment of Wendy Pennington to Human Resources Generalist Trainer in the Human Resources Department. Item 3, authorize the promotion of Stephanie Smith from Deputy Warden Treatment to Chief Deputy Warden in the jail system. Item 4, authorize the promotion of Tracy Beebe from RN Staff Nurse to Case Manager at the Berks Heim. And then item 5, authorize the 2021 salary compression adjustments as outlined on the attached listing. We have one item listed under purchasing, adopt a resolution authorizing the award and the Director of Contracts and Procurement to execute one contract as a result of the request for proposal for individuals with disabilities employment study for the Berks County Workforce Development Board. It goes to Thomas P. Miller and Associates out of Indianapolis, Indiana, and it's a not to exceed amount of $55,762.80. There's one item listed under Commissioner Barnhart, adopt a resolution authorizing the appointment of Betsy Carlisle, Moulton, Pennsylvania, to the Reading Regional Airport Authority for a 5-year term expiring February 13th of 2026. There are two items listed under Commissioner Rivera. Item A, adopt a resolution authorizing the reappointment of Thomas J. Mitchell, Bartow, Pennsylvania, to the Reading Area Community College Board of Trustees for a 6-year term expiring June 30th of 2027. And item B, adopt a resolution authorizing the reappointment of Dean E. Schaefer, Reading, Pennsylvania, to the Reading Area Community College Board of Trustees for a 6-year term expiring June 30th of 2027. Several items are listed under the Commissioners. Item A, adopt a resolution authorizing the appointment of Daniel Sanseri, Reading, Pennsylvania, to the Berks County Housing Authority to fill the remainder of a 5-year term which will expire December 31st of 2023. Item B, adopt a resolution of the Board of County Commissioners disapproving the request from Denali Water Solutions to waive the PADEP 60-day public comment period requirement for conducting of a transfer of a general permit. Item C, adopt a resolution of the Board of County Commissioners approving the establishment of a county recovery team whose purpose will be to examine current departmental practices and operations with respect to the PA Department of Health, Center for Disease Control, and county COVID policies moving forward, and the potential of change to any or all of those practices or operations dependent on prevailing conditions. Item D, adopt a resolution approving the allocation of the funding in the amount of $3,230,000 from the COVID-19 Hospitality Industry Recovery Program grant for applicants approved by the Greater Reading Development Fund CHIRP grant administrator per attached listing. Item E, adopt a resolution authorizing execution of the Berks County Adult Probation Office Grant and Aid for fiscal year 2020-2021 application to the Pennsylvania Commission on Crime and Delinquency. The grant is in the amount of $454,488 and is 100% reimbursed by the state. Item F, adopt a resolution authorizing the chair to execute the 2020 Court Interpreter Services Grant from the Administrative Office of Pennsylvania Courts in the reimbursement request amount of $346,794.66 to provide on-site, in-person courtroom interpreting services at the Court of Common Pleas and Magisterial District Judge levels. Item F, adopt a resolution authorizing the chair to execute the 2020 Senior Judge Reimbursable Cost Grant from the AOPC and the reimbursed request amount of $72,650 to offset the cost of senior judges and their staff. Item G, adopt a resolution authorizing Dennis Adams, Berks County Treasurer, to open a new government banking investment account with Santander Bank at the opening of rate of 0.10%, 10 basis points, and further authorizes execution of any and all necessary documents upon final review and approval by the County Solicitor's Office. Item H, adopt a resolution of the Berks County Board of Commissioners declaring an emergency to exist as a result of a need to increase the size of ballot paper from 8.5 by 14 double-sided to ballot paper size 8.5 by 17, which will require the printing and mailing of 3 inserts instead of 1, therefore authorizing the execution of Amendment 1 to a specific agreement. Item I, adopt a resolution authorizing execution of the Berks County Adult Probation Office grant application to the Pennsylvania Commission on Crime and Delinquency for the County Intermediate Punishment Program for fiscal year 2021-2022 in the total amount of $410,000. Item 2, a motion authorizing execution of contract agreements and amendments as set forth on the attached listing dated April the 20th of 2021. There are a total of 9 contracts. There are 4 with Children and Youth Services, 1 with Election Services, and 4 with Mental Health and Developmental Disabilities. Item 3, a motion to ratify and confirm payments as set forth on the Controller's Office voucher listing dated April the 20th of 2021 and the payment of electronic transfers and employee payroll.
Motion to approve the agenda is presented.
Second.
The motion has been made and seconded. Is there any discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Aye. Opposed? The motion is carried. We'll turn now to our Berks County Treasurer, Dennis Adams, with the Treasurer's report. Dennis.
Good morning.
Good morning.
We have an opening balance today of $199,629,892.06. A balance to clear of $5,554,299.16, leaving us with a balance of $194,075,582.90. The COVID hospitality sits at $1,469,460.86.
Thank you very much. Our County Controller is not here today. In her absence, we'll hear from Grozna to give us the County Controller's report. Grozna.
Yes, good morning, Commissioners.
Good morning.
The disbursements for April 22nd, accounts payable, amounted to $12,444,551.29. There was no payroll for the week of April 22. And wires, HC wires for community care behavioral health amounted to $5,554,389.14. And that was the total disbursement.
Thank you very much. We'll move now to our Chief Administrative Officer, Ron Seaman.
Thank you, Commissioner. There's nothing new to report at this time.
Thank you. And we'll move now to Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach, and again, good morning, everyone. 2 comments about our agenda today. I want to first congratulate Deputy Warden Stephanie Smith, who is now Chief Deputy Warden, on her ascension to that position. She came highly recommended by our Warden Jeffrey Smith, and she'll do a tremendous job in his absence. When he is unavailable, she steps in and takes over the role of the warden. So congratulations and best wishes to Chief Stephanie Smith. Under Commissioner Barnhart's authorizing the appointment of Betsy Carlisle to the Reading Regional Airport Authority. She was a tremendous find. She's a private pilot, an instrument-rated pilot, and she had worked for some period of time at the Reading Air Charter facility, and she actually surveys pipelines during the week. She flies from Virginia to Maine and surveys pipelines. So she's a great addition to the Reading Regional Airport Authority. Had a very good interview with her, and she has some really creative ideas on bringing more of a marketing and economic development aspect to the airport. And last but not least, last Saturday was the drug take-back event at First Energy Stadium's parking lot from 10 to 2. It was a great success. In the very first hour, 6 full bags were collected. So for a total from 10 to 2, 19 bags amounted to 723 pounds of expired or unused medication. I was there from 10 to 12. There was about 180 cars that came through. It was just a real great event to see people coming out from Berks County to drop off these unused medications. And we also dispensed the drug bag that can dissolve drugs at home. If you have a small quantity of drugs, you can put those in this bag. There's a chemical reaction with warm water. It dissolves the medicine and then it becomes unusable. You can throw those in the trash. So it was a great event for everyone. And people got free Reading Fightins tickets out of it too. So a great event. I want to thank everyone who was there. The Berks County Medical Society, SOS Berks, and the District Attorney's Office. It was a good day was had by all. Thank you.
Thank you very much. Commissioner Rivera.
Yes, thank you, Commissioner Leinbach. I'd also like to congratulate Chief Deputy Smith on her promotion. She's been doing an excellent job, and we look forward to her doing the same job at her new position now. So congratulations. Also, just wanted to remind you that this Monday, on Monday, April 26th, from 7:30 to 8:30 on WFMZ Channel 69, the awards for the What's So Cool About Manufacturing contest will be presented. They were filmed this week at the DoubleTree, but it will be broadcast at 7:30 on WFMZ Channel 69, and then right following after that, it will be broadcast on BCTV as well. So if you don't have the opportunity to see it at 7:30, you can see it at 8:30 on BCTV. Also this Monday, in my County Connection program, which is at 6:30 on BCTV, I will be visiting 2 local businesses and a local nonprofit that benefited from the New Start Grant Program, which was part of the CARES Act, and also from the CARES Act funds. So tune in to learn about the CARES Act, how that finished, and to look at these businesses that I was able to visit and learn about how they were impacted and how they benefited from this money. The ERA program, the Emergency Rental Assistance Program, applications are being taken now. There were a few changes made. One, there's no longer an online application. It is now a paper version of the application. So you can go into the website bceh.org to view and print the application, so you can do that. If you do have any questions, you can call them. Now, they do ask that you be patient with return calls, because at this point they have limited capacity to answer calls, and they're working diligently to be able to correct this issue. So again, the applications are back up. You can go to BCEH, and they also have what are called access points, which are different organizations throughout the county where you can go and get the applications, get help completing the applications, and drop off information as well. These access points are listed on the BCEH website. So if you live, say, in Boyertown or another area of the county, you don't have to come to the BCEH office in downtown Reading to be able to provide that document and get the help you need. So for more information, you can call or visit the BCEH office. The phone number is 610-372-7222. Again, that's 610-372-7222. For the CHIRP, which is the Hospitality Industry Recovery Program grant, the first round has closed. The second round opens on Monday at 12 p.m. and it closes on Monday, May 17th at 5 p.m. So again, if you know of anyone that has a business within the hospitality industry, please let them know about the CHIRP program. We want to make sure that the word gets out to as many businesses as possible. For more information, they can go to www.rebuildberks.com/funding. Again, that's rebuildberks.com/funding. And also want to thank and congratulate Daniel Sanzari for his appointment to the Housing Authority. Daniel works for Neighborhood Housing Services and has many years of experience in this area in helping the community with housing and financial issues. So Daniel, congratulations on your appointment to the Housing Authority. And that's all I have.
Thank you very much, Commissioner Rivera, or as someone said yesterday, Commissioner Riviera. On our weekly call, after we asked how to say somebody else's name, I had to be careful almost to not laugh out loud, but I thought, well, maybe I've been saying it wrong all along.
No, you've been saying it right. There's no way in it.
Yeah, two things. One, I also want to offer my congratulations to now Chief Deputy Warden Stephanie Smith. I think it's very exciting that we were able to promote from within. The new warden was Deputy Warden of Custody. Our new Chief Deputy Warden, Stephanie Smith, was Deputy Warden in charge of treatment. I'm confident that we have a great team in place and really glad to see Stephanie step up and fill this critical position. One other person I want to recognize, and I would tell this individual to turn their camera on, but I know this individual well enough that she won't do that. Yesterday was Administrative Assistant Day, and my administrative assistant, Mary Buer, has been an amazing asset to our office. I don't know where I would be without the work that she has done she's in her 14th year, the same as I am. I rely on her for input and advice on virtually every decision that I make. She is a critical part of the team. Internally, folks know that she is planning to retire at the end of the year. And this is probably the last time I will get to acknowledge her as for Administrative Assistance Day and the work that she has done. She's a critical part of the team, and I'm not sure exactly where I'll be without her. If you want opinions, you can talk to my colleagues. I'm sure they have some very frightening perspectives on the way things could be without Mary behind and working alongside of me every day. But thank you very much, Mary, for all you've done over these many years, and especially over the last 13, 14 months, which clearly have been the most challenging time I've had as commissioner, and I know that you had as an executive assistant and as the other part of my team. So thank you.
So just momentarily, I do appreciate those kind words.
Thank you very much.
It's been a very interesting experience working at the County of Berks. A great experience. No, thank you.
You're very welcome. You're very welcome. You got about 2 seconds of Mary. I was amazed that she turned her camera on all these years, and I will tell this funny story. I have asked her many times, would you be on my County Connection program with me? She doesn't do that, and she does a great job in everything that she does. So I'm blessed to have her. With that, we will open it up to any comments from our row officers. Seeing none, we'll turn it back to Mary Buer and we'll go to public comments.
Thank you. Fred Zendgraf Sr. from Berkshire Heights. Greetings, commissioners. A free and fair November 3rd, 2020 election would have continued and improved upon President Donald Trump's accomplishments, some of which follow. Achieving a record-setting economic comeback by rejecting blanket lockdowns. An October 2020 Gallup survey found 56% of Americans said they were better off during a pandemic than 4 years prior. During the third quarter of 2020, the economy grew at a rate of 33.1%, the most rapid GDP growth ever recorded. Since coronavirus lockdowns ended, the economy has added back over 12 million jobs, more than half the jobs lost. This is a small part of the January 2021 White House showcase list. The current administration policies will have a negative impact on these positive accomplishments to the detriment of our posterity. In every election, all parties should know the ground rules well ahead of time. Just like in financial systems, there must be standardized internal controls to rule out any possibility of illegal conduct. There can be no ambiguity. There can be no opportunity for counties to handle matters differently. There must be clearly defined rules and uniformity across the Commonwealth. To change the rules during the race and even up until the votes have already been counted is wrong and undermines the election process. That is what happened in the November 3rd, 2020 election. That is why faith in the election system has been shaken for many. Copied from the January 19, 2021 letter to 2 Pennsylvania legislative leaders from numerous county commissioners, including Berks Commissioners Leinbach and Rivera, the previous paragraph I could not agree with more, as well as the entire letter contents, and appreciate effort to address travesty of the November 3rd, 2020 fraudulent election. Keep up the good fight for free and fair elections. Thank you and Godspeed. William Mulgrew of Greenwich Township. I'm very concerned whether a county health department will be a bottomless pit where no one really knows the long-term costs. If we adopt a county health department, then we have to continue paying state taxes for all the other counties which don't have one while paying for our own. The costs of public health should be shouldered by all taxpayers across the Commonwealth. I request our commissioners to exercise that financial responsibility we need in leadership and hold the line against such largesse. Dwight Wegman, Lower Heidelberg Township. I look forward to the commissioner's report on April 28 discussing election reform. Topics I host will be addressed are the results of canvassing of voter rolls to determine the extent of ineligible voters in precincts that have more voters than eligible people. What measures are being taken to determine that new voters are citizens and living at their registered address, and firewall measures to prevent any unauthorized access to voting machines or election services servers via the internet at any time, before, during, or after the vote. I'm also interested to hear if election services will be doing hand recounts of a number of precincts after the election to verify the accuracy of the results. All of these measures are necessary to instill trust for the public in the integrity of our election processes. John Archer, Spring Township. In last week's April 15, 2021 Commissioners meeting, Commissioner Leinbach expressed a degree of frustration in having a number of commenters not having based their concerns or their accusations on factual information. The Commissioner's statement seems to be a very reasonable request to make in order to reduce commenters' frustrations and maybe even their concerns when county residents are able to actually understand the circumstances or context of a given situation, program, or the legal basis on which our county government is legally postured to function, then the advancing of resident opinions is significantly more constructive. For those individuals who are harboring sincere concerns, it would seem that some of their frustrations could be alleviated at least in part, by not making assumptions of how county operations are conducted and leadership decisions are formulated, by instead preparing questions for submittal to learn the facts instead of developing poison pen letters, which may only serve to shut down effective dialogue. Once the facts and the context are explained and understood, then opinions would have more of a solid basis or foundation, which then can be more effectively support positions on various issues. Additionally, many comments which are of a critical nature in many instances fail to give our elected officials and their professional staffs any benefit of the doubt, and instead tend to paint our officials' actions in a very negative fashion, as if they were uncaring, unwilling, and uncharitable individuals, which is a real stretch. Having had an opportunity to interface with many county workers, I must say that the courtesies that have always been extended, their ability to effectively communicate, and the professionalism and qualifications exhibited are really an asset which many other counties would love to have. John James, Burnville. It is disheartening to see the citizens of the nation that returned representative democracy to the world fall into partisan propaganda regarding their elections. Those people alleging fraudulent elections, when none have been found, are more disrespectful of our veterans and troops than any kneeling athletes. Thousands of Americans died protecting our belief in democracy. To have someone disparage that very institution so very lightly. If you have proof of fraud, please present your evidence. Crystal Kowalski, why I'm missing. Good morning, commissioners. The county has chosen to incarcerate weekenders at a time when we are registering our highest daily COVID cases and have had a confirmed outbreak at the prison. I would like to present two facts that challenge the assertions put forth at last week's meeting. Fact one, the county has the discretionary power to postpone these incarcerations. This is quoted from a docket. Order directing DEFT to not report to the jail until weekend of January 22-21 due to COVID-19 pandemic. This order came from the president judge and was ordered a second time, postponing the report date of February 26, 2021. The president judge clearly has this discretionary power. Fact two, the 4 men serving weekend sentences during this incredibly high-risk time are incarcerated for summary offenses that are listed on traffic dockets. All were sentenced by MDJs. One of these MDJs was found to have falsified government documents and violated someone's due process rights just before the pandemic began. I want to put this in the clearest possible terms. The county is knowingly endangering the weekenders, the prison staff, the people incarcerated at the prison, the families and co-workers of the weekenders, and the community at large. Why would the county assume this risk of community spread? One reason we were given last week was to recover fines and costs, in other words, for money. to report on my continuing pursuit of prison COVID case numbers. I have followed up with Prime Care and have not received any response. I have also reworded my request to the county in a new right to know request. An attorney at the ACLU instructed me to point you towards section 67.506 parentheses D parentheses of the law, because inmate medical services are a governmental function. Indeed, medical services are constitutionally required under the 8th Amendment. Thank you. Risa Marmontello, Amity Township. Will the county establish drop boxes for the May 18 primary election? That concludes the comments from the Q&A.
That closes our comment period. The comment here about the jail is quite frustrating. The weekenders, and we went over this last week, the weekenders are tested for COVID before they're brought into the jail. If they test positive, they're not incarcerated for the weekend. Number two, yeah, it is about money. It's more about the money that these individuals are able to earn because they're able to keep their jobs. That's the issue. Having somebody serve a full 30-day sentence in 30 consecutive days pretty much guarantees their job is gone. Number three, please get your facts right. When you keep saying the word county, you imply that somehow the county commissioners can dictate on weekenders, or that the county commissioners can dictate to MDJs. We cannot. We have no authority over the courts at all. And we've discussed this before. I would really appreciate facts. Facts. There's not a whole lot of them in this particular comment. Commissioner Barnhart.
Yes, thank you. And in response to Risa Marmontello, the drop box decision has not been made yet. There has been information gathered by Ron Rakowski, Pam Schupp, and Ron Seaman to make a recommendation back to the election board. But I will, just by virtue of numbers, tell you that last spring's primary was a presidential primary. We received 32,000 mail-in and absentee ballots. We received 74,000 in the general election in November. So far to date, we have received mail-in and absentee requests of 14,000. So this is certainly not an overwhelming number. It's 14,000. We don't see this number ticking up much more than 14. So realistically, we'll probably receive between 10 and 12,000 actual ballots back. That's a blip on the radar screen. That's something people can certainly put in their mailbox and or the potential of a drop box here at the services center. So don't think that we're going to be expanding the number of drop boxes here that we had in the fall, which we had one here and one at the Ag Center with about 10 to 12,000 mail-in and absentee ballots. Thank you.
And I would add to that, Commissioner Barnhart, there's still basically no rules surrounding the drop boxes. That's one of the things we're waiting from to hear from the legislature and the governor on those issues we've raised. They were also raised in one of the comments that has to do with the integrity of the voter database. Those rules are governed by the Commonwealth of Pennsylvania. The rules on pre-canvassing, all of those different areas. Some of that will be dealt with at next Wednesday's weekly update, where we'll hear from our elections department. Commissioner Barnhart, I believe you'll be facilitating that program as chair of our election board.
Correct.
And we will be talking about recommendations that have been made both internally and externally that the county has the authority to institute and will be instituting for the primary. A lot of the big things that people want addressed and that county commissioners want addressed for clarity and continuity across the Commonwealth have to be done by the legislature and by the governor. Those are being worked on, but I don't anticipate them to be in place for the primary election. Commissioner Rivera.
Yeah, I just have one comment, and it's in reference to the jail. I've always been taught personal responsibility for my actions, and I've been taught that if I break the law, there's consequences for my actions as well. So I just think we need to sometimes put the, what's the word I want to use? Put the onus on us to not break the law, to do things properly. That way we don't have to worry about spending 30 days or weekends in jail. If I decide to drink, I do it at home to make sure that I'm not hurting anyone else out on the road, or maybe taking the life of some innocent person that has no reason to be hurt, just apart from that I was drinking. So I think, yes, there's things that we have to do. Not everyone needs to be incarcerated. Not everyone should be incarcerated. There needs to be other programs to help the people that get incarcerated. But on the same token, I believe in personal responsibility for our actions, and that there has to be consequences to our actions. If not, then why would I follow the letter of the law? So that's what I have to add. Thank you.
Thank you. Anything else?
Motion to adjourn.
Second.
The meeting stands adjourned.